The first thing is to be really clear about what your values are when it comes to alcohol use and drug use, and to discuss that fairly frequently with your children. There's been lots of evidence that where parents have those conversations and do them in a way that allows for discussion rather than closing it off, that helps children to develop properly, develop healthy attitudes towards drugs and alcohol. We've seen lots of studies which suggest that parents think that they've had those conversations. There's one that the Department of Health conducted where they said, have you had that conversation about drugs with your children? And 75% of parents said that they had, but only 35% of the children remembered having that conversation. So that suggests to us that it's really important to keep on having those conversations, to keep on coming back to it, and using some of the everyday things that we see in our newspapers or on the television as prompts for discussions, rather than waiting for something terrible to happen. So, use the soaps that you watch with your children, use the newspaper stories that you see in there, and start the conversation off in an open way. So ask about things like, what do you think of, rather than don't you agree with me. Do it in as warm a way as you possibly can, so that it's not about accusation. It's really important. We have lots of young people that we talk to who say, we've had the talk, I got told, it's my way or the highway. And that maybe feel appropriate from an adult point of view, but from a young person's point of view, they want to explore these issues. They have friendship groups that are developing that might change over time, and their mores, their social norms, and their understanding of what drugs and alcohol can do change over time. And it's important that we keep coming back to these issues and having these conversations, as I say, relatively frequently. And one more thing, talk to your children's school about it as well. Find out what their approach is to PSHE or to drug and alcohol education in school, and make sure that they are getting the same messages at home and at school.